Hello, my name is Chrissy, got a long surname, Awojinrin, and I'm a clinical systems trainer at Great Western Hospital NHS Foundation Trust. I will hereby refer to it as the Trust. I'm here to welcome you to working at the Trust as a student nurse and hopefully gently introduce you to some of the information technology that you will encounter here. Right, as I mentioned already, the aim of this session is to give you a brief overview and introduction to the IT and clinical systems that you will use when you work here. So we are going to cover using computers in the Trust. How do nurses use computers in the Trust? We're going to look at the main clinical systems used in the Trust. We'll cover IT training and IT support, and there's a little quiz at the end to make sure that you have stayed awake. So what computers will nurses use here in the Trust? Well, most of the computers you'll use, most of the IT will be very familiar to you. You use them at home. You will encounter tablets, iPods, Android devices, and desktop PCs. That strange one with a beam flying out of it is an iPod, an ordinary iPod, with a kind of wraparound jacket that has a scanner attachment that allows you to easily scan a patient's wristband. Wristbands carry a barcode, and so by scanning a barcode you can quickly grab the patient's hospital number and feed it into the application that you're using on the iPod. How do nurses use IT in the Trust? Well, there are actually quite a lot of functions that you use IT for. You use IT to record observations, to record and update patients' care plans, to record medications that you administer to patients. If you're a senior nurse, you'll be writing your own prescriptions to patients using IT, to escalate problems to other professionals, to query past and current patient treatments, to request blood tests and other investigations, to access test reports and radiology images, to hand over patient care to your colleagues, and many, many more activities. So one question you may be thinking is, how on earth can I use computers when I'm busy dealing with patients? Well, computers aren't intended to stop or prevent or slow you dealing with patients. The aim of IT is to communicate and to create reports and to make reporting and decision making based on real information that's quickly gathered. They also help with best practice. This allows different teams to follow the same ideal procedures and policies. A handwritten note has problems. It can be difficult to read. You wait till you see a doctor's handwriting. It's only available in one location at a time. And of course, it can easily be misplaced. IT systems and information technology eliminate these problems. Here is a diagram that shows a summary of the main clinical systems in the Trust. At the centre of our IT systems is our Patient Administration System, our PAS or PAS. Here we use a PAS called Medway. If you work at another hospital elsewhere in the country, then you will encounter other PASs such as Millennium, Rio, EMIS, System 1. But here we use Medway. Medway knows who our patients are. It knows their personal details, their name, address, date of birth, GP name, hospital spells, what letters we've sent to them, what letters we've sent to their GP, clinical notes, and far more information. You can also stay within the Medway application to access a patient's test results and radiology images as stored on other systems, because Medway links to several of our other IT systems. Then we have a system called the Electronic Discharge Summary, or EDS. This is an application that makes sure that we have joined up care between the hospital and GPs in the primary care service. So following a patient's discharge as an inpatient or an emergency patient, an electronic discharge summary letter is sent to the patient's GP to tell the GP why the patient was in hospital and what we did to them while they were here, and also what we would like the GP to do with the patient back in the community. EPMA is our drug prescribing system. It stands for Electronic Prescriptions and Medicines Administration. In a nutshell, clinicians prescribe medicines and nurses administer those drugs to our patients. When you're a senior nurse, you will be able to prescribe certain medications to your patients directly. CVIS is our cardiovascular information system. CVIS grabs information from the patient's heart monitor readings and it crunches the data and generates reports that you can use to determine how to manage the patient's care. Nerve Centre is a new kid on the block. It's an app running on a mobile device, an iPod, that you use to capture and view patients' observations and to manage tasks and alerts. More about that later. ICE and MedView are to do with requesting radiology and pathology investigations for your patients and viewing the results and charts that have been fed back by the radiology departments and the pathology laboratories such as microbiology, blood sciences, haematology, virology, cytology, etc. All of these laboratories feed their results back into ICE and MedView for you to look at the results. There are many more IT systems used in the Trust. Here's a little taster diagram showing some that can be accessed from the intranet. Don't be daunted, you'll be only using a handful of these and you'll get very, very familiar with the ones you need to use. As I said, Medway is our patient administration system, our PAS or PAS. It has a lot of functions and it's very heavily used in the hospital and outside of the hospital as well by the community staff. You use it to register brand new patients to the Trust, to locate patients who are being treated in the hospital, so you know what ward they're on or whether they're in the emergency department, what cubicle they're in, etc. You also use it to update their personal details and transfer them to different departments, different wards, or to record that the patient's been discharged home or to another institution. It's used a great deal in the emergency care department to record the condition, diagnoses and treatment of patients who've had accidents. And it's also used in outpatients for you to see a list of the patients due to attend or who are present in an outpatient clinic. EDS is our Electronic Discharge Summary application. It's used to safely transfer a patient's clinical information to a GP upon the patient's discharge as an inpatient. It's our way of telling the GP that their patient has been in hospital, either in emergency care or on an inpatient ward, and this is what we did to them. It tells the GP the history, the diagnoses, the medications we gave the patient and medications we gave the patient to take home with them. It details what procedures we carried out on the patient, any allergies we determined. It also includes information and advice to the GP about treatment we would like the GP to ensure is carried out to the patient back in the community. EDS improves the quality and consistency of care. It ensures that there's a smooth transition and no loss of information between the care of the patient in the Trust and the care of the patient back in the community with their own GP. Some of you may have already encountered EPMA, or our Electronic Prescriptions and Medicines Administration System, because there is online training that you are able to do across the intranet. In a nutshell, doctors prescribe medications and nurses administer the prescriptions to the appropriate patient. It carries out a lot of other activities as well. Chief amongst them is the fact that it replaces paper charting. It supports safe prescribing by providing prompts and warnings. So if you are trying to prescribe two medications that they interact with each other dangerously, then EPMA will alert you to that fact. It will also alert you if you are prescribing something that the patient is allergic to. EPMA supports safe prescribing as prescriptions are legible. It provides access to an up-to-date drug library with details of what the drugs do, when they should be used, ideal doses, contraindications, etc. Prescription and charts are digital, which means that they are simultaneously accessible by more than one person and they don't go missing, which are key problems with paper charts. Doctors can access and update prescriptions from their office. They don't have to actually visit the patient if they need to update a drug prescription. They can actually do it remotely. Pharmacists can also check prescriptions remotely and amend them if necessary. A patient's prescription history is easily accessible using EPMA. You can see what they had 5 years ago, 5 weeks ago here in the Trust. And above all, EPMA promotes consistency and safe practice. Typical use of EPMA by nurses. The first thing you do is check you've got the right patient in front of you, and then you look online and check the EPMA prescriptions for that patient as written by doctors. Back in the real world, you prepare the drugs and you administer them to the patient. Then you go back onto EPMA and you record the date and time that you gave the medications, or you record why you weren't able to administer the drugs to the patient. Usually doctors write the prescriptions, but senior nurses can also prescribe medications. ICE is a system that we use here in the Trust to order tests and investigations on our patients. So radiology, x-rays, MRIs, CT scans, and also pathology investigations, microbiology, blood tests, cytology tests, etc. We use the ICE system to request all of these. It replaces paper-based requesting with a very user-friendly online form. For blood tests and other samples, you can collect and label the specimen at the patient's bedside after scanning the patient's wristband. Scanning the patient's wristband ensures that you've got the right patient. You're ordering the right tests for the right patient. It's something called Positive Patient ID. You may want to look that up. When the results are processed by the laboratories, you can view the reports in the ICE system in the form of tables and charts, and using that information you can see whether the patient is deteriorating or their condition is improving. As student nurses, you are unlikely to be requesting tests, but you'll probably be taking and labelling certain specimens as well as viewing patients' reports and charts. Nerve Centre is a little application that I view as the future of medical IT. It's an app that runs on an iPod, and you use it to record the patient's observations such as blood pressure, temperature, oxygen saturation at the patient's bedside. So you type those readings into your iPod after you've taken them. Nerve Centre has various rules behind the scenes, and it can calculate the patient's NEWS score and whether they're showing any signs of sepsis. So these are automatically calculated, and then you can look at the alerts that are generated and decide whether you wish to alert a doctor to the patient's condition. Nerve Centre will then alert the clinician who's on duty and responsible for that patient that that patient is having some problems. The doctor receives the alert and he or she must decide whether they are going to deal with the problem immediately and come over and see your patient, or whether they need to pass on the task because they're busy doing maybe a procedure on another patient, or they're too far to respond in time. And the beauty of Nerve Centre is that it will then escalate the alert to another doctor, maybe a consultant or the senior nurse in charge on the ward. It has various other facilities as well, including you can create your own tasks around patient care or create tasks for other people. You also can use Nerve Centre for patient handovers to the next shift. You can record various assessments and notes about the patient's condition. So falls, dementia, MUST assessments can all be recorded on Nerve Centre. It also has an inbuilt instant messaging facility. So you can message your colleagues who are also working and using their own Nerve Centre iPod. And you can also, if necessary, attach a patient record to your message so they know who you're talking about. And also you can use Nerve Centre to record that the patient has been transferred to a different bed. To train how to use Nerve Centre, there are interactive online courses. Great Western is probably a little bit odd in that we have two patient administration systems. The reason for that is that in the community, the nurses and doctors use System 1, and it is spelt like that. There is no E in the system of the name, so it's System 1. So that's used by our community staff. If you work in the community as a student nurse, you'll be using System 1. It has all of the features of Medway, in that you can view patients' demographic details, you can update them, you can view their letters to their GP and letters to the patient, you can view the patient's medical records, you can book appointments to see the patient, you can request tests. It's everything that Medway can do, System 1 can do. It has an advantage over Medway in that it shares a lot of information with GPs and other primary care institutions. So that's all I wanted to cover in terms of a summary of the main IT systems that you're going to encounter working here. You will of course receive classroom or online training to use any of the clinical systems that you need to use. Please do shadow experienced colleagues, watch them, learn from them, ask them questions. Don't be shy about asking questions. It's the only way you can learn in some cases. When it comes to something like EPMA, the drug administration system, your drug administrations will be checked by qualified nurses. And for any of our systems, IT, pharmacy and pathology support are simply a phone call away. In addition to all of the above, you will have access to free online e-learning if you want to improve your Office skills, your Microsoft Office skills, so Word, Excel, PowerPoint. Here's a little tip: go to the intranet homepage, type IT skills and click the first item that returns in the search results and register using that page that you land on, and you will then have access to free online e-learning to improve your Microsoft Office skills. And the beauty of it is that you can access this e-learning from home or on site. And something you no doubt will become very, very familiar with is the phone number to call IT support. The IT service desk is on extension 5858. Do scribble that down, it will be very useful. If you have any questions about this brief overview of the IT and clinical systems used in the Trust, please email myself or the other IT trainers on gwh.it.training@nhs.net and we'll get back to you. Okay, and I'm not in the least bit sorry about this bit. I'm an ex-teacher, and one of the things I do like doing is checking that people have stayed awake during my teaching. So here's a little quiz to see if you recall anything that we've just gone over. So grab a piece of paper and scribble down your answers to the following. Question 1. What do the letters PAS stand for? Question 2. Name one of the disadvantages that we covered regarding paper notes, paper case notes. One disadvantage of using paper. Question 3. What is the name of the community patient administration system used by the Trust? I won't penalise you if you get it spelt wrong. Question 4. What device and application do nurses use in the Trust to record patient observations? Question 5. What is the name of the system used to request tests? And question 6, which will become second nature to you when you start at the Trust, what extension do you dial for IT support when working at Great Western Hospital? Okay, and the answers, and I'll go slowly in case you're still scribbling down your answers. Question 1. What do the letters PAS stand for? And the answer is Patient Administration System. Question 2. Name one disadvantage of paper case notes. And the answers are only one user at a time, they can be illegible, and they are easily lost. Question 3. What is the name of the community patient administration system used by trust staff? And the answer is System 1, with system spelled SYSTM. But I won't penalise you if you've got that bit wrong. Question 4. What device and application do nurses use in the trust to record patient observations? And the answers are iPod, they use an iPod, and Nerve Centre, the Nerve Centre app. Question 5. What is the name of the system used to request tests? And the answer is ICE. And finally, what extension do you dial for IT support when working at Great Western Hospital? And the answer is, of course, 5858, which by now should be etched in your minds. You can use that number if you wish to contact the IT trainers as well. So we have covered how you are going to be using IT at Great Western Hospital, the kind of devices you will encounter. We covered the main clinical systems that you will encounter. So I hope that when you start working here, these acronyms won't be foreign country to you. You'll understand what people are talking about. And we went over IT training and support. So I hope that this has helped you feel a bit more confident about working in the trust, especially with regards to using IT. Thank you for your time and good luck on your course.